the first question people always ask was, how do I know if I need nitric oxide? How do I know if I'm deficient? And so about 15 years ago, I developed a salivary test strip that we could test your saliva. And what we were testing were the ability of your bacteria in your body to reduce nitrate to nitrite. So when we sample saliva, we're looking at, number one, are you ingesting enough nitrate? Do you have the right bacteria to convert the nitrate to nitrite? Because on the saliva test strip, we're measuring salivary nitrite. And I think I tell people that's a good tool to have in your toolbox. There's no false negatives. If you're low, you're low. But there are some false positives. And that's why I've gotten away from the test strip, because there's people with active dental infections, oral infections, show that they're kind of optimal on the nitric oxide test strip, but systemically they're completely depleted, right? The best example is a 50-year-old hypertensive, overweight, diabetic patient with ED. He spits on the test strip and it's bright pink. Well, obviously this guy isn't replete in nitric oxide. It's a false positive on his test. So what we rely on, and it's the question you brought up, we have to rely on symptoms. So if you're nitric oxide deficient, what happens? The first thing that typically happens is you develop erectile dysfunction, right? Because when you lose the regulation of blood flow, when you can no longer dilate the blood vessels of the sex organs, whether it's the penis or the clitoris, and that's dependent upon nitric oxide. So if that vascular bed can't generate nitric oxide to dilate those organs to get engorgement, then you're nitric oxide deficient. You develop erectile dysfunction. That's, as you said, the canary in the coal mine. That tells you that something's wrong. That's usually first. Second, your blood pressure starts to creep up, right? When you lose the production of a main vasodilatory molecule, nitric oxide, blood vessels start to constrict, they get rigid, they get stiff, and now with each beat of the heart, they causes damage. This pulse wave travels really quickly through the vascular tree, causes a lot of damage, endothelial dysfunction, upregulation of adhesion molecules, platelet aggregation, monocyte neutrophils start sticking to the lining of the blood vessel, and you start to get plaque. Then thirdly, typically you develop exercise intolerance. So if you walk up a flight of steps, you become short of breath and you just can't catch your breath, or you can't even go out and walk 20 minutes without feeling tired. That's a nitric oxide deficiency problem. If you're insulin resistant, type 2 diabetic, that's a nitric oxide deficiency problem, because nitric oxide is required for insulin signaling and glucose uptake. And then typically fifth, you lose your memory. You develop mild cognitive disorders, if not corrected, vascular dementia, if not corrected, Alzheimer's, because all of those are a loss of regulation of blood flow to the brain. When you don't get blood flow to the brain, you can't get the good stuff in, you can't take the trash out, beta amyloid plaque builds up, tau tangles, the hallmarks of Alzheimer's.
So you mentioned the test strips there being an objective way of testing this. I know there's also a test I've heard you talk about called the endopat. Talk more about what that is, and then if you feel that's something that is only warranted if we're suffering from other symptoms like you mentioned, or who should get one of those done?
I think everyone should. This is a functional test. It's a non-invasive functional medical device. But it's really the only device that tells us how well our blood vessels are making nitric oxide, right? And so the basis of this, we call this flow-mediated dilatation or reactive hyperemia. So the basis of this test is you put a blood pressure cuff over your brachial artery up on near your bicep, and then you inflate this cuff to suprasystolic levels. So now there's no blood flow into the forearm. So you're completely shutting off the blood supply to the forearm. And you do this for 5 minutes. And it's a little bit, I wouldn't say uncomfortable, but you start, it's like kind of like sleeping on your arm, right? And your arm falls asleep. You're going to get tingling. But what happens is when you release the cuff, now these blood vessels and tissues have been deprived of oxygen for 5 minutes, and they want to increase blood flow. And they do this through the production of nitric oxide. So you can look at the degree of vasodilation, what's called reactive hyperemia, and that tells you, and through a pretty complex algorithm, it can tell you your endothelial function, or how well the endothelial cells of your blood vessels produce nitric oxide. If you get a lot of vasodilation, that tells us that your blood vessels are making sufficient nitric oxide. If you don't get any dilation in response to releasing the blood pressure cuff, then that tells us that your blood vessels aren't making any nitric oxide. And even though you may not have ED or high blood pressure or any of the symptoms we talked about, that's really the first sign and symptom that you're on a very slippery slope to developing chronic disease, ED, hypertension, everything we talked about. So now you need to take corrective steps and figure out, why aren't my blood vessels able to make nitric oxide? Is it because of my diet? Is it because of what I'm doing? Is it because of some drug therapy I'm taking? Is it? And then you got to start asking questions, and then start doing the things that we've shown clinically to enhance endothelial nitric oxide production.
All right, just so I'm clear, the test strip, I see how that's going to be testing the second pathway, although not perfect. You talked about how there can be issues there. Doing the endopat, it sounds like it in the beginning when you're talking about it, it's testing the endothelium, but then you mentioned taking in nitrates, I believe. So what I'm getting at is, what can we decipher from each test? Is it an overlap of the two different pathways, or is it one is testing one and one is testing the other?
The test strip is kind of measuring what we call total body nitric oxide availability. So whether you're getting nitric oxide produced in the lining of your blood vessels from the endothelium, that nitric oxide is primarily oxidized to nitrite and nitrate, right? And so the human body doesn't discriminate nitrate coming from the diet or nitrate being produced from the oxidation of nitric oxide. It just sees nitrate circulating in the blood. And then through the silane receptor, it's taken up in our salivary glands and then secreted in our saliva. Then we reduce it to nitric oxide. So if you're low on the test strip, let's use an example. If you test your saliva and it doesn't turn pink and it's completely white, that tells us that you're low in nitric oxide. But it doesn't tell us why you're low. Is it because you have endothelial dysfunction and your endothelial cells can't make nitric oxide? Is it because you're not getting enough nitrate from your diet? Is it because you're getting enough nitrate from your diet, but you're using mouthwash and you don't have the right oral bacteria? So, but now you can start to interrogate each of these and then figure out exactly what's going wrong and why the test strip isn't lighting up. But the very important distinction is the test strip is a biochemical test. It's measuring a single molecule in one biological compartment. The endopat is measuring the functional production of nitric oxide in the lining of the blood vessel. So a functional measurement will always be more reliant and meaningful than a biochemical test, because there's too many factors that are affecting the biochemistry in the saliva and the nitrite in the saliva.
And when it comes to both of those tests, how far back are they looking? Are they just kind of looking at the last 24 hours and how much nitrate we've taken in plus our endothelial function? How do we get a picture over a longer period of time? Is it just doing the tests again and again?
Yeah, any test we do, whether it's a blood draw, whether it's a functional test, it's basically one point in time, right? It's what's in your blood at the time they did the blood draw. Same thing with the test. It's how your blood vessels are reacting at the time we do the test. Is it when you're fasted? Did you just eat a really unhealthy diet? And we've done these studies. So if you do it fasted, you can show good endothelial function. You go and eat McDonald's fries, an inflammatory diet, then you redo that test, you're going to have a blunted response to your endothelial function. And then some of our clinical trials we've done with our product technology, you can get a baseline endothelial function, take the lozenge or take our nitric oxide, 4, 5, 6, 12 hours later, we retest, and now we can improve it. So all these tests are basically capturing a single moment in time based on what you did before that. So I think to get a true sense of how your body's reacting or performing is you do this over time and track it. And if it gets better, then I tell people don't get away from what's working, keep doing it. If it gets worse, then you got to stop and think, what am I doing that's making my endothelial function worse?
Right. As you explain that, it gets me thinking about the person that goes on a week vacation and forgets their mouthwash at home. And then all of a sudden they try and do a test to see where they're at. And, you mentioned, I think it was only 4 days that the bacteria can start to repopulate and start converting. So I could see how things could change quite rapidly.
Yeah, look, I've been studying the human body for more than 25 years, and I'm still just in awe of how resilient it is. Even though we insult the body, some people insult their body every day, all day, for years, decades, and yet they're still living, right? The body's so resilient. They may not be healthy, but the body's still performing in some capacity or they'd be dead. So I think it's just remarkable that the body's able to put up with all this abuse that we give it. But yet it doesn't have to be that way. We understand the biochemistry, specifically as it relates to nitric oxide, that we know what interrupts it, we know how to improve it. And so for me, there's really no excuse. And there's no excuse for cardiovascular disease being the number one killer of men and women worldwide, even today. Billions of dollars in research. We know what causes cardiovascular disease. We know how to diagnose it, and we know how to fix it. What's the problem? It's education and awareness, right? We have to go out and change the way people are treating cardiovascular disease. We have to bring nitric oxide to the fore and make it the number one consideration for physicians seeing patients with poorly managed chronic disease, uncontrolled high blood pressure, uncontrolled diabetes. Why is that? Well, think about nitric oxide. Nitric oxide controls insulin signaling, glucose uptake, regulation of blood flow to every organ, tissue, and cell in the body. And it decreases inflammation, oxidative stress, and immune dysfunction. Every single chronic disease, whether it's diabetes, heart disease, Alzheimer's, same three things. Decreased blood flow, inflammation, oxidative stress, and immune dysfunction. Nitric oxide corrects every single one of those.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
For me, it's no wonder why we have the sickest population on the planet. Everything we do is disrupting nitric oxide production. If you can't make nitric oxide, you're going to develop chronic disease, cardiovascular disease, Alzheimer's, diabetes, chronic fatigue. If you use mouthwash,